about coronavirus and Parkinson's disease, and this is a really terrific opportunity to do a Facebook Live. We will be recording this morning. We want to reach as many patients with Parkinson's disease. We want to reach family members, and we just want to help you to gain a better understanding, answer your questions, and address all the things that can really make your lives better and help you to get through the next several weeks and several months. This is brought to you by the Parkinsons Foundation, which is at parkinson.org. And I'll also mention that we are putting up lots of coronavirus information at parkinson.org/corona. And so if you look at Parkinson Foundation and Corona in your search engine, or you type parkinson.org/corona, you'll find everything. A lot of the questions that we're going to talk about this morning, we've already typed out answers, questions and answers for you. That'll be made available. And Dr. Southwick, who is our distinguished and honored guest this morning, also has a series of slides and information on corona that we're going to make available. And so let me start by introducing myself. Many of you know me. I'm Michael Okun. I'm the medical director for the Parkinson's Foundation since 2006. We're here to answer your questions. We also have an amazing staff with Leilani Pearl, John Lair is our CEO, and Kathy Whitlock, and Adolfo Diaz, who runs our helpline. And so on our helpline, we are able to answer questions, and we've been tracking all the corona questions. And so this morning, we've actually answered all the questions that have come in on our helpline, and we're going to make those live for you and make ourselves available to answer those questions. My distinguished guest this morning is Dr. Frederick Southwick. He and I have been friends for many years, and he is the former chief of infectious diseases here at the University of Florida Health. He's also an author. He's written multiple books on all sorts of topics, including improving the quality of our healthcare system, on medical errors, and is really engaged with everything that's going on with the coronavirus and how it can affect Parkinson's. So we're so lucky, and hopefully we'll be able to have him back. So welcome, Fred.
Thank you, Mike.
Thanks for joining us in the Fixel Institute for Neurological Diseases. We're in our webcast room, and it's great to have this conversation this morning. And we're seeing questions come in already. And so what we're going to do is we're going to have a conversation for everyone this morning, and we're going to try to hit some topics. And so let's just start out with a few generalities for people. People talk about flu, but coronavirus is not flu. It's something that's it's very different. And so maybe you could just back up and in lay speak, tell us a little bit about what's different and why are we calling this a novel virus?
Well, it's a novel virus because it actually came from bats in Hunan in China, and it mutated this unusual cold. Usually it's a cold virus, but this one is more virulent. That is, it causes more harm, and it actually created a mutation in the bat that actually allows it to bind very tightly to a certain receptor. It's angiotensin II receptor, and the affinity is higher than SARS or MERS. So it is be able to actually infect people more efficiently. And we talk about R factor. If you are infected and you infect one person, then it's an R of 1. If on average one person's infected and they infect 2, it's an R0 of 2. This is probably an R0 about 2.5. It could be as high as 4. So it's highly infectious. And the other big problem is, just like MERS and SARS, it is more lethal than the regular coronaviruses. And what happens is it gets into the nasopharynx, and it'll hang out there for about 2 or 3 days with fairly high counts of viral particles. And during that period, when you don't have symptoms, you actually are quite infectious. So if you sneeze just once or twice, you can spread it to others. And then after about 48 hours, it moves down into your trachea and your bronchi, and then it gets into the little breathing sacs, the alveoli of the lung. And there it causes a lot of inflammation, and it causes the lining of the alveoli to leak. And serum comes into the alveoli, and they fill up with fluid. and then they can't exchange oxygen.
So when we say alveoli, we mean the little air sacs.
They're little air sacs that actually exchange oxygen. They are critical to the lung functioning properly. One other situation where they have problems is when patients have congestive heart failure, their heart backs up, the alveoli can fill with fluid. So it's very similar to severe congestive heart failure in that way. And then the problem is people actually feel like they're drowning. It's a very scary thing. And then if the inflammation continues and the host doesn't fight it off, the lining of the alveoli becomes fibrosed. It gets this scar tissue, and then it can't exchange oxygen. And people are dying 3 weeks after they get the infection because of this fibrosis. So it's scary, and the problem is that it seems to affect people that are older. 60 and above seems to be where the biggest problem is. And it also affects those with underlying diseases, in particular hypertension, congestive heart failure, and chronic lung disease and diabetes are the four. And then we don't know about immunocompromised hosts yet. There haven't been enough. But the mortality at age 60 is about 5%. At age 70, it's 8 to 10%. And above 80 and above, it's actually 15%.
Wow.
So I've been studying infectious disease for over 40 years, and I have to tell you, this is by far the most dangerous virus that I've encountered and the worst epidemic in my career.
Wow. So, I mean, I think that should really draw our attention, and you know, and I've known you for a lot of years, so even hearing you say that has gravity to me. Personally, and I know the people that are out there watching and trying to learn are really soaking up some of the details. So I want to go back a little bit and just rehash a couple of things. So one of the things you said that I thought was interesting is they call it novel, and it's novel because it hasn't been seen before in humans. So this is a brand new virus. It's also novel because it started in a host that was in an animal. So it went from a bat to a human, which is pretty interesting. And remember when we talked about bird flu and other things, that, you know, those diseases also went from animals to humans. And so since it hasn't been seen before, so the people that are watching are interested in the immune response. If you haven't seen a virus before and it's novel, can anybody have antibodies to the virus?
Probably not. We don't think so. There are these little knobs. You've seen pictures of the virus everywhere, and the knobs are what are responsible for binding, and that's where the major antigens also is. And it turns out that the sequence of the knobs are extremely different from other coronaviruses. So we would not, and we don't have significant antibody to it.
Yeah.
And so we're not protected.
So I think that's really important. So no matter how many weights you lift, how robust you are, whether you don't get sick, since it's a novel virus, none of us have antibodies. It's, you know, there's this old fashioned, you know, notion that that is somewhat true when you have kids, that you get all these colds and you start to build up an immunity because you get exposed all the time. Nobody's ever been exposed to this virus.
Exactly.
And so without those exposures, the immunity is not out there. And so this, you know, raises a really important point for us. And so in terms of thinking about, you know, like, okay, so you have Parkinson's disease, and we have labeled, and so for everybody watching, we have labeled Parkinson's disease. You are at risk. You're a high risk group.
Agree.
Okay. And so everybody agrees Parkinson is a high risk group. Okay. So if you have Parkinson's disease, you're in a high risk group. You know, what are the 3, 4, 5 things that you would tick off and say, you know, like, try not to worry, but do these things? What would those things be as an infectious disease expert?
Yeah. I think what you want to do first, the emotional set. You can't panic. You should respect this virus, and you should follow the infection control protocol. And I shared that brief video, which actually outlines what the CDC recommends, what everybody recommends. And because it is spread mostly by coughing and little droplets, we know that the range, and actually I didn't share this on the video, the distance you should be from anybody is 2 meters or 6 feet. the droplets will drop down and will not reach you, so you will not inhale them. The second way that you may pick it up, and we aren't sure, is you cough and it lands on a surface. And we call these, with dust combined with virus, called a fomite. It's a curious name, but that's what it's called. Anyway, these viral particles are known on certain surfaces, particularly hard surfaces in stainless steel. They can survive for up to 3 days.
Wow.
That just came out in the New England Journal today. The previous one said 9 days. That was another coronavirus. But for this one, they've actually tested this one. So 3 days. So what does that mean? So you have to, as socially distance, you have to stay away from people. You have to assume, because the other thing that just came out yesterday in Science, there was a modeling that took place to look at the number of cases and the number of symptomatic cases. And the conclusion of the model is that for every symptomatic case, there are 8 people that are asymptomatic that are carrying the virus.
Okay, so for every symptomatic case,
there are 8 others.
There are 8 other asymptomatic
and
cases.
And we have not found them. South Korea did a terrific job of testing, and they found all these people. And what they did is they isolated them. What you have to do when someone's infected, you isolate them, keep them away from everybody else, so when they cough, they don't spread it.
Okay.
And then if you have a contact, you would put them, you don't know that they're infected, you quarantine them. So a healthy person, you quarantine. A person's infected, you isolate.
Okay.
So but the only way to identify them is by testing. And unfortunately, our country got way behind the 8 ball when it came to testing. South Korea has done 285,000 tests. We have done maybe 12,000, maybe 25,000. And the population of South Korea is a lot smaller than the United States. And so we have not tested, so we don't know who those people are.
Okay.
So that's why we're recommending you not go anywhere that's got more than 50 people. When you do, and you have to shop, just keep people away from you. When you're standing in line, and I think this is now being recognized, at least 3 feet standing in line, but try to stay 6 feet away from everyone. It turns out that wearing a mask is not helpful. And if you're infected, you should wear a mask so you don't infect others. But if you aren't infected, it's not been proven to be helpful. So what you do is, the other thing, you've got to keep your hands, which are going to touch the surfaces and touch those infected fomites. And then you do not want to touch your face. There's this T space, they call it. And that's your eyes, your nose, and your mouth. Do not touch those, because that's the way the virus gets from hands into your body. So you want to wash your hands, and what they're recommending is that it turns out the virus is pretty fragile, and the outer wall is fragile, and it's very susceptible to soap. So it turns out that soap is the best. So soap and water, maybe if you go out, as soon as you get home, you wash, you don't touch your face, then you wash 20 seconds. It's got to be 20 seconds. And I remember I came back, I was working in the emergency room, and I came home, and my wife, she said, wash your hands. And I only did it for 10 seconds. She was furious at me.
Yeah.
So you've got to do the 20 seconds.
Right. Let's turn that down. We're getting a little feedback here. Sorry about that.
No, it's not doing it.
Sorry about that. We got a little feedback here, everybody.
Yeah.
So she was furious. Your
She
wife was furious at you.
And one of the things, principles that she's pointed out, and I agree, is it's not only about you. If you get infected, then your whole family is in danger. And it turns out when you look at in China, 85% of the cases were spread within families.
Wow.
So if you go out, get infected, and then come back to the family, you will infect the family. So it's really important to be a little paranoid, wash your hands, and then also surfaces, any surface you're working on. The other thing you're supposed to do is you're supposed to clean your phone once a day. And you use an alcohol wipe will work. The nice thing about the virus, it's very susceptible to alcohol. It's very susceptible to almost all detergents. And they actually have a list of them, but pretty much everything will kill this virus. So these are all the things that you need to do.
Wow, terrific. Yeah. Thank you. And we've addressed our feedback issue here from the studio. I want to rehash a little bit here, in terms of some of the things that we need to to focus on. One is when we wash our hands, okay, washing our hands for 20 seconds, okay. What I do is I always sing happy birthday to my, I have two children, so I sing happy birthday to both, right? You got to, so each one gets it both. And then if you're really careful, you include another relative or your wife or your spouse or something. So washing your hands, very important. The outside of this virus, as Dr. Southwick says, is very fragile. Okay, so we can break that. Socially distancing is good. So we're doing an educational program this morning, and we are providing a very bad example for you. So Fred and I are here around
I forgot
this,
to ask Mike if he's traveled recently to any of the countries, or if you've been exposed to anybody.
Yeah.
I have been sitting at home.
Yeah. So I've been at home as well. Okay. And but having said that, I want everybody to understand it needs to be 2.5 to 3 times the distance between Fred and I right now. Last night on the news, if you're watching people voting, they showed some pictures of people in Illinois and in Florida. They were distancing 6 feet between each other in the long lines and then distancing between the voting machines. So certainly, you know, super important to do that. Now, one of the things I want to ask you about as an infectious disease expert is this term social distancing, okay? And it's sort of something that we don't have as much data on it in infectious disease circles as we would like. But this idea of social distancing, you know, can you either support it or dispel the myth? Because you have some people, even doctors and other people saying, oh, this is hogwash, it doesn't mean anything. Tell us a little bit about why the experts, why the CDC, why the World Health Organization in Geneva is saying socially distance and it's going to make a difference. So can you make the argument, Dr. Southwick, as to why that makes a difference? So I want you to convince all the Parkinson patients and their family members who are watching why we believe that makes a difference.
Well, I think China is the prime example. They got the outbreak got away from them. So ideally what you'd like to do is find the few people that are infected and then identify them and then all their contacts and quarantine their contacts. And then the virus would die down. You wouldn't get that infect 2 to 4 people. But that didn't happen because there's a lot of patients were asymptomatic for a significant period of time, it spread. And so once that happens, you can still continue to case control and isolate people and quarantine them. But what you really have to do is you have to say, we think anybody can be infected. They mandated that people stay in their house for 2 weeks or 4 weeks. Then the other thing they did is they actually set a boundary around the area that was most highly infected and said, you cannot travel outside of this boundary. So they actually put a fence around. Now, by doing these things, by being very strict and people actually followed these, nobody went to work. All restaurants were closed. All theaters were closed. Any social event, they all ended. What happened is the curve, which had been going in a steep exponential, flattened out and then went down. I understand the last 2 days they've had 1 case each day.
Wow.
Is really impressive. So we know that it is draconian in some ways, and it feels unfair, and it feels a little bit like you're being put in jail. But it's the only way to save lives, because the more people that are carrying the virus, the more likely you are to actually become infected. And so each of us has to be cognizant of others. Now, young people are not going to die from the virus, and some of them my wife's on Facebook a lot, and she saw pictures of kids in bars, highly crowded, hugging each other. And that's a nightmare, because it's high. If there's one person in there, everybody could become infected, and then they will interact with older people, and so they will become the nidus from which the spread goes to those that are in great danger and Parkinson's patients. So it's really important to check with your children and check with those that are younger to make sure. And the other thing I heard is because the airlines, no one's flying, they're all going away. They're getting cheap airfares and they're flying. So they feel, and this is immortal, and this is it's a classic adolescent or late adolescent behavior, but they may be, but you aren't. And so it's important to talk to your kids and tell them, hey, you have to be responsible. You have to be considerate not only of your fellow friends, but you have to be considerate of the next generations.
Right.
Yeah.
So this is a great overview, and I want to shift a bit to talk a little bit about the Parkinson disease specific issues for people that are sitting with Parkinson. I want to welcome. I'm watching the questions and the greetings come in from all over the country,
Wow.
from Louisville, Nevada, Brooklyn, Israel, multiple countries. So welcome, to our Facebook Live, and we're happy to have you. I'm sitting here with Fred Southwick, who's an expert in infectious diseases, the former chief here at University of Florida, who's developed a very nice video that's already on our website at parkinson.org/corona, okay, on the Parkinson Foundation website. And also he'll have a series of lectures and slides that we'll provide, and a summary from today. So let's talk a little bit about Parkinson, okay?
Right.
There's a myth out there, and maybe it's not a complete myth, that Parkinson's disease patients have a compromised immune system. What we know from research is that some of the cells that are part of the immune response in Parkinson are a little different. And we're actually using that to better understand Parkinson and to engineer therapies for Parkinson. So there are T killer cells and all of these different cells. The way they function in Parkinson seems to be different. And so there are great researchers like Malu Tanzi that have really embraced this, David Standard and others that are really interested in this concept. As far as I know, however, the immune system functions in a relatively normal way. And so I just want to ask you, do you agree with that concept that in general, the immune system of a Parkinson patient is intact?
Yeah, I do agree. I think the problem is, as I outlined, the where the danger is in the respiratory tract. And unfortunately, the muscles and the gag reflex and the cough reflex for Parkinson's patients can be impaired. And so they are not, if they get this infection because of the physical constraints, they are at higher risk for, because what happens is patients hyperventilate. When you put on a pulse ox, they can't, their pulse oxygen is usually below 92%, and they don't respond very well to oxygen. They often need 4 liters of nasal oxygen just to keep their oxygen levels up. So if you can't take deep breaths, it's going to be harder for you to oxygenate. And so I think it's very dangerous in Parkinson's disease because of the physical more than the immune system. Right now, there are very few studies on how the host fights off the coronavirus, and there's a lot of myths, and I don't think anybody knows. They're starting. I saw a preliminary study yesterday. They're looking at CD4 and CD8 and all the cells, but it's just descriptive. There's no mechanisms.
Right, and we're seeing questions come in from all over. One just came in from Boise, Idaho, and I think that what we want to tell people is the bottom line is Parkinson patients are at greater risk. You're in a high risk group. Your immune system does work.
Right.
But when the virus gets into your lungs, and particularly the little areas Dr. Southwick talked about that exchanges the oxygen, called the alveoli, that can get a little scarred down, and it can become really problematic. It can be an issue. And in Parkinson, we always tell people, I tell people in my clinic, the things we want to prevent: falling, fractures, and aspiration pneumonia.
Right,
Okay.
exactly.
And it's a high risk for those 3 things. And so if you get infected and if you get a pneumonia, it's a much higher risk with or without this particular issue.
Right.
Now, the other thing to mention is that it's a virus. So that means we don't have an antibiotic. Okay,
Right.
so we don't have a specific treatment for it. And you see viruses like the common cold. Can you talk a little bit about that? The misconception when a Parkinson patient comes in and says, I have an infection, give me the drug for that infection. Is there a drug for COVID-19?
Well, first of all, viruses, antibiotics do not work. And when you look at the white cell count on these patients, usually it's normal. It's only about 20% is that they're all elevated. There's a test that looks versus bacteria versus viruses called the procalcitonin test, and that is low, indicative of virus. There really is just non-specific reaction. There's a little bit of Your C-reactive protein, which is just overall inflammation, may go up. But there are no markers to indicate bacterial. Now, the problem is what can happen with this virus. You can stimulate what's called a cytokine storm, and various cytokines, which are inflammatory agents that increase your host's reactivity, can actually turn against the host and be damaging. And then you can get a sepsis-like syndrome, and you can get hypotension, you can get organ failure. And they're seeing that in a modest number of cases. There's some possibility that maybe IL-6, which is one of the cytokines, may be too high, and there's actually some studies looking at antibody directed against to reduce IL-6.
Yeah.
And then there is one antiviral. Let me get I'll tell you the right one because I don't want to. There's one antiviral I think that is very promising.
We're going to post these Dr. Southwick slides up on parkinson.org/corona. He's a real expert and leader in this area and has really been trying to help to educate.
It's called remdesivir.
Okay.
Remdesivir actually affects, it's an RNA, an adenosine analog that actually causes the virus has to reproduce the RNA in order to create new virions, new viral particles. And this analog actually fits into the RNA chain and blocks its further lengthening. And it was actually developed for Ebola, but it didn't work on Ebola. But the evidence so far is it's highly suggestive that it is effective. Now, it's produced by Gilead. There are 5 clinical trials, 2 I think in the United States, and there's one in China, and there's several in Europe. So, you can get it if the patient is really an extremist, extremely ill. You can get it just what they don't call it mercy. I've forgotten what there's a name for it.
Sure. So compassionate use.
Compassionate use. That's
yes,
it.
The FDA calls it compassionate use.
You can do that.
So this would be, so there's a discussion going on in the U.S. now, and that discussion is starting to interface not just with governmental authorities, but also with the pharmaceutical industry about making things available. And so there are 2 discussions that are going on in parallel. So I want our Parkinson viewers to understand what Dr. Southwick is referring to. One, which we'll get to in a minute, is the potential for making a vaccine, okay, like the flu vaccine. And the second one is there a pharmaceutical, an antiviral drug that can slow down or help in some way if you become diagnosed with COVID-19? And so there are 5 clinical trials on this one drug that's promising because it's working on a part of the genetic code called the RNA, which we think is important. Now, I will tell you anecdotally, since we're on a Parkinson webcast here, that a lot of our Parkinson patients take an antiviral drug, and it's called amantadine. And amantadine was decommissioned in 2005, 2006 by the CDC as an antiviral drug for use against the flu. But the reason that we have amantadine in the arsenal for treatment of Parkinson's disease is because a couple of Harvard neurologists, Schwab and Poscanzar, gave amantadine to somebody for flu prophylaxis in the late 1960s and noticed the Parkinson symptoms got better because it has effects on dopamine. So now it's been decommissioned as a flu drug, and we use it in our Parkinson arsenal. So there's no evidence that amantadine will help in this infection, but there are ongoing negotiations with these pharmaceutical companies to see if there's something that could impact with that RNA part of the code that might help with this particular outbreak. Now, you wouldn't take it prophylactically. This would be for people that are known, that are infected and tested positive at this point.
Right now, one of the things I've heard, and this is, I haven't read studies specifically, but it seems you want to take it early, a lot like, the anti-flu. You want to start it early when if you do use it.
So the flu mists and those antivirals. But just to be clear to everybody who's watching, don't run out and try to get this drug. It's not there yet, but you may see it in this outbreak. You may see some deals made so we can make this available. I want to shift for our Parkinson patients. We're seeing lots of questions from New York. So welcome, New York, particularly Brooklyn seems to be on the line quite a bit. And I want to shift to ask you about the vaccine. So there's a lot of myths about vaccines and okay, well, we're just going to go out and, you know, hire the most promising companies. And there are companies now already who are engaged. Anytime an infectious agent shows up, a whole bunch of scientists all over the world rush to make vaccines. That's what they do. That's what they love to do. They want to help people. They want to impact. So I want to make sure that we talk straight to the Parkinson community and tell them how long it actually takes to make a vaccine. So can a vaccine be available in 2 weeks, Dr. Southwick, 2 months, 1 year, 2 years? How long does it typically take to make a vaccine?
Well, the NIH about 10 years ago recognized the importance of more rapid production of vaccines. They actually have a vaccine center in Bethesda, and they have come up with better techniques for generating amino acids for specific surface proteins on viruses. They also have used DNA plasmids that actually produce the proteins after injection. So once the sequence of a virus is known, you can identify specific targets. And there already are vaccines that have been developed, and my understanding is they're actually in trial right now. The problem is the time from trial till the prove efficacy is at minimum a year. I mean, that's just, you've got to wait and see whether you've got enough people to show whether it's, you've got to have a control group, you got to have a vaccine group, you have to compare them, and that's going to take a year before. So it's
unrealistic, would you say?
2021, mid 2021.
Okay, so I think just for everybody who's watching with Parkinson, I don't want to make anybody, you know, uneasy, but I just want to make sure that we're clear, because I think when you have an epidemic like this or a pandemic, you want to make sure that you're clear with people. The clear and honest truth is that logistically and scientifically, it's going to take a year or more to get a vaccine going. We might be able to catalyze that a little bit here or there, but for the time being, what we face is a situation where we as Parkinson patients and as a Parkinson community are going to need to face down this virus without a vaccine.
Right.
So the better way is to begin to make deals with these pharmaceutical companies so that we can get some medicines that'll break up the RNA and see if we can impact the corona. If you get it early, better, like the flu mist. So we're definitely working on that. Dr. Southwick said, wash your hands. Okay, a lot, 20 seconds or more. Don't make sure that your spouses don't yell at you for not washing. And you can never wash too much. Socially distanced 2 or 3 times the length of what we're at. And then we've had a number of questions, and welcome to Wisconsin coming on here. And we had a number of questions around the country. And one of the things that several of our people who are watching this live are asking, and I'm going to ask you directly, Dr. Southwick, is they want to know, should they lock their doors and stay inside with their spouse and keep their spouse inside, and should they socially isolate themselves from family members, and should the Parkinson patients just say, okay, we can beat this thing by not being exposed? Tell us the wisdom of that, and because there's a lot of fear out there, and so both, you know, people get cabin fever from being locked up, and then also a lot of our Parkinson patients, and I just saw another post that came in here from, I think, Boise, Idaho, but certainly from the Midwest, where they said, I'm getting a lot of anxiety because my spouse is going out, and I'm afraid my spouse is bringing back in the bug to me, and it's going to put me at high risk with Parkinson. Can you speak to that, Dr. Southwick?
You know, we as a race, as a species, have fear of infectious disease is actually built into our basic behaviors. And so we do fear infectious disease, and with good reason, because if you were cavalier about it, you died. So I think this fear, you know, don't want to panic, but a little fear is a good thing. And yes, I would. My wife actually was upset that I was coming here.
Okay, all right.
And I am because I'm older. I'm not working in the emergency room anymore. I told him that I had to stop. I can't work in clinic right now. I'm trying to help virtually. There's a lot of telemedicine that can be done. There's actually an amazing amount of stuff with our electronic records that I can help with. So I'm going to try to work virtually. And that's, I know that some lower socioeconomic individuals don't have internet, but really virtual connection works very, very well. And for instance, our residents now, we are not having the conferences anymore physically. And we just started on Friday. I gave a conference on meningitis, and it was virtual. And I did a morning report on Monday that was virtual. Everybody was everywhere.
Wow.
And it actually worked incredibly well. It takes a while to get the skills and to want to participate and turn off your mute and talk. But if you get used to it, actually, it's not as good as face-to-face, but you don't feel as isolated. So I would recommend that, governments should make the internet available to everyone, because this now has become far more important than it ever was before. The solution, unfortunately, is to stay away from everybody. Now, what can happen if we get the testing going is you can, if anybody has a hint of a symptom or a hint of a contact, you do the test. If the test is negative, then you can feel pretty safe. Now, the problem is sometimes it doesn't pick up cases. It's got a sensitivity of 71%. So it's not perfect. So if you get a negative, I calculated you still have about a 1 in 5 chance that you could still have it. But that's better than you don't have no idea.
Right.
So it would give us guidance. And the other thing it would do is if a lot of tests are positive in your area, then you've got to be really careful.
Right.
If they do a lot of tests in your area and they're all negative, then probably you're safer to go out. So there will be pockets of infection where there's a high concentration of those asymptomatic carriers. There'll be other areas that don't have it. Now, New York City is a disaster because when you think about it, the big cities everybody lives in big cities because they love to go to plays. They love to go to concerts. They
so it's
love
the perfect ground for
yes, they love to go to restaurants. So they've been gathering together, and they were gathering together in the last 3 or 4 weeks. I like to think of this of a case. When you get a symptomatic case, think of it like a star. When you see light from a star, that was emitted probably 2 or 3 years ago. When you see a symptomatic case, that case was developing probably 2 weeks ago.
Wow.
So you are seeing what happened 2 weeks ago. Since that time, there are many more that are incubating and are about to take off.
Right.
So right now, because we don't know who is infected at all, I think the only safe thing to do is assume everybody's infected right now and follow and really stay isolated as much as you can, and use your smartphone, use the internet, and you can fulfill your social and so being socially connected is very, very important, or
right.
you will get depressed and you will get more anxious. So it's very difficult. But I know there were questions about planes. Don't fly.
Okay.
I'm not flying. In fact, the University of Florida won't allow us to fly now.
That's right.
They actually
most universities
yeah,
have
all the
shut
universities
down.
have shut that down.
Yep.
As a physician, I have an obligation not to get infected because I would infect my patients. So the same you have an obligation not to infect your family members. So I think the person whose wife is going out, you got to tell her,
right,
she's endangering
right.
you. She is.
Right.
She is.
So I want to shout out too that we have a 1-800 the number 4 PD info helpline. It's a 1-800 helpline and an online forum that we've run for Parkinson Foundation for many years. Adolfo Diaz is just terrific, and he takes care of questions, and we've answered over the years with the old Ask the Doctor forum, and now we have online patient forums. We've answered 20,000-30,000 questions from every continent except for Antarctica, and it's been a great service. And so I want to mention that to people that are watching, and I also want to shout out because I have a series of questions that have come in on the helpline, and I want to sort of tick through a few of those because I know people that are watching are interested.
Yeah, one area that was in the questions was nursing homes and rehab facilities, which are very, very important. And it really depends on how rigorous the infection control in those places are. If you see that the workers are not washing their hands or are not, you want to limit. Unfortunately, you can't have people come in because they could be infected. So you really have to stay. The walls have to be tight there. And then the problem is the workers, if they're not being careful outside of that institution, they can bring it in.
Yep.
So if you can get out of the rehab facility, if you can get out of the nursing home, you're probably safer to be at home where you can control the environment. But if you need to be, I think it's really important to watch the infection control, ask the people in charge what they're doing, and are they following the CDC guidelines, which are very rigorous for institutions, what they should be doing.
Right.
So,
and let me just add, Dr. Southwick, I agree with that. And I just want to make sure that we speak plainly and directly to the Parkinson patients. The Parkinson Foundation is recommending that we stay at home, we limit visitors, and hopefully there's no visitors to the home.
right.
We can get deliveries and things in and out, try to stay as clean and just stay away. Whether you're a young Parkinson patient or an older Parkinson patient, we consider you at high risk. That was a question that came in from South Florida and from a few other areas, both on our helpline and is lighting up now. So young or old, we consider the Parkinson patients high risk. We want you to socially isolate. And when you socially isolate and distance, you can become anxious. And so it's really up to us as a community to use the technology. We need to pick up the phone and call people multiple times a day that are isolated. We need to get on the telelinks. We need to get on FaceTime. If you've got somebody who's stuck in a nursing home or stuck at home, or a family member that's at home, it's not as safe for you to go visit, but try to connect with them multiple times a day. This is something we can all do together to really help, because cabin fever sets in, okay? And we want to keep people safe, but you want people to know that they're cared about, that people are. So talk as much as you can on the phone. It's completely safe. So everybody picking up the phone and talking as much as you can to create this sense of decreasing the anxiety around the cabin fever is really important. Now, what we recommend when you're in a facility, like a rehab facility or a nursing facility, sometimes your medical problems will require you to have that amount of care. Okay. And so the best thing you can do is advocate for that facility, that they need to be washing their hands. They need to monitor that T on the face, keep their hands off of the face. You can play a role in being the nagger of the people that are taking care of you, making sure they understand what your expectations are, and then setting up telelinks when you can't get them out of the facility, so that you call them multiple times a day, have multiple people call them, let them know that you care about them. And just reach out. I mean, I can't tell you how awesome the power of just social interaction is for people and calming people down in a crisis. And so one thing we can all do is we can help to calm people. And don't be so quick to remove your relative from a nursing facility or rehab facility or the hospital. Talk it over with your doctor. Think about the risks and benefits. Once you do it, they're going to be there for several months. Do you have the right equipment? Do you have the right gear? Are you going to be able to get the right medicines? A lot of these people are on a lot of medications. They need a lot of support to be turned. So you may actually make them less safe rather than more safe. And so this is a discussion between you and your medical team. And just be sure that you are making the right call. But use tele and use lots of interaction. Now, the other question that's come in to Adolfo Diaz on the helpline is about vaccinations. And we talked about this briefly, and I want to just rehash specifically for the Parkinson patients. We recommend that you get the Pneumovax each year. Okay. Regardless of your age. If you have Parkinson, you're at high risk. Don't let them tell you you're too young to get it.
Yeah,
okay.
Actually.
All right. So we recommend
it's very safe. It's very safe and very effective.
Okay. So here you see our infectious disease expert. I didn't pay him to agree with me. It is a very safe vaccination. It's very effective, both the Pneumovax and the FluVax, and those are two separate vaccinations. And the pneumococcal vaccination protects us against several of the bacterial things that
Well,
can
strep
cause it.
pneumonia is the leading bacterial cause of pneumonia and can be very, very aggressive. So it's really important to get the Pneumovax.
So one of those is for bacteria, folks, and that's the Pneumovax, and one of them is for virus, okay? And so you can protect yourself by doing those things. And remember, falls, fractures, and for this discussion this morning, pneumonias. Those are the things we worry about in our Parkinson patients. We want to play prevent defense as much as we can. And so preventing that pneumonia is super super important. And so I think it's really important. So
yeah, one other thing, two other things as far as cabin fever. You can go out and walk in the woods. You can go out to a park if you're far away from others. The open air, actually, the likelihood of droplets ever reaching you is infinitesimal. So it's safe to be outdoors. The problem is in enclosed environments. Like this room is not particularly good, Mike.
Yeah, we got a soundproof room here. It's great for this, but don't follow our example here.
The other thing is pets. It turns out there's no evidence that pets can carry this virus. And therefore, that is a great soothing to have a cat or a dog. And so I think if you have a pet, don't worry about the pet and enjoy the pet because they will keep you company.
Okay. We want to welcome on. We've got Naperville, Illinois, just joined. I was recently in Naperville for a chess tournament with my son. It's a great place. You have more Starbucks on every corner than anywhere else in America. So welcome on to Naperville, and they want to know about dental work. So, and this brings up a really important point, Dr. Southwick. So we're in this position where we're saying to people, you know, it's better if you stay home. Okay, it's better if you isolate. It's better if you have Parkinson, you're at high risk. Let's get out of the way of this virus and let's let things pass. I've got a dental appointment. I've got a medical appointment. You know, I've got these things. What's the decision-making process here?
Well, I had an appointment last Friday and I canceled it because it was just a well visit, a 6-month well, and I felt great. So I just canceled. So I think what you have to do, is it elective? Is it just preventive at this point? Then I would cancel it.
Okay.
If you have obviously a bad decaying tooth, or you need something pulled, you need real dental work, then you've got it. You should go. But for routine cleanings, etc., you can wait 2 months.
Right.
So
here's the answer we want to give everybody. If it's not urgent, you don't have an abscess in your mouth, it's not urgent. If it's a regular cleaning, if your doctor's appointment isn't urgent, reschedule it. Okay. Get 3 months of your medications. Push your insurance company. Some insurance companies only want to let you have a month at a time of medicines. Push them. This is the time.
Right.
Get 3 months of your medications. You can get it through the drive-through. You don't even have to go in the pharmacy. And in fact, most pharmacists are really nice people, and I know maybe of you may be in the drive-through, so you don't get to interact with them, but they're super nice, super well-trained, and they get it. So if you go through the drive-through of the pharmacy, here's another free tip for you. A lot of times you can ask them, could you get me some allergy medicine too? Could you get me something? They'll actually go grab it, or they'll have a tech grab it for you. So if you're at high risk and you can say, look, I'm at high risk. I don't want to go into the pharmacy, but could you grab me this? They will help you. I mean, people are really great when it comes to crises, coming together and helping. And so I want to just tell people, if you can get a 3-month supply of your medicine, that's probably going to take you through. We have several questions here from overseas, from Israel and other places about, I'm worried that my medicines are going to run out, or there's going to be shortages. Well, the good news is that in areas where there are factories like China, they're starting to get back up and going. Okay, so that's good. And so the manufacturing apparatus in some of the other countries, since it has at least been staged throughout the countries, is coming back. But the safest thing you can do, get 3 months of your medicines. And if you need something from the pharmacy when you're picking up your medicines, ask the pharmacist if they would be nice enough to just go grab it for you off the shelf.
One other, which is moving very fast, is the use of telemedicine. It turns out, when I work some in the clinic, in a general internal medicine clinic periodically, and I'd say 90% of the time, the physical exam does not help me. And it's a follow-up exam. History is very important, and how they're doing. and reviewing their medications and reviewing tests, you really do not need, the physician does not need to be physically next to you to make decisions. And we all have electronic records. So FaceTime, or we're using Zoom a lot. And that really, in some ways, actually, I can give better care because I'm not having people bug me. I'm in a quiet place. I can look things up. I can make decisions quickly. So I think you can get very good care from telemedicine in most cases. There's very rare that and the other thing is, if you have a skin lesion, take a picture of it. Mm-hmm. It's amazing how effective that is. In fact, dermatologists can make the diagnosis about 90% of the time from a picture on the phone. Yeah. There actually are, if you have a heart condition, there actually are apps, smartphone apps for auscultation.
Yep.
So theoretically, you could transmit the sound. And the other thing is, I have an Apple Watch, and I keep track of my heart rate. And one of the things is, you get older, you worry about AFib. And you can do an EKG on your smartphone. And fortunately, I'm always in normal sinus rhythm. So I enjoy that. So there are a lot of smart tools now that allow you to get virtual care.
That's fantastic. And I want to just emphasize that the future of healthcare is going to be in telemedicine and in sensors, and just what Dr. Southwick said. And sometimes it takes a crisis for the American healthcare system, or any system, or a hurricane, to blow things. And we as a Parkinson community have been working around the clock for over a decade. And my hair is going gray, Dr. Southwick, over this.
At least struggle. You kept yours.
Yeah. So it is going gray over the struggle, because in the American healthcare system, we actually define the telemedicine encounter, by where the patient is and not where the doctor is. So if you practice medicine, so I'm in the state of Florida, if I practice medicine by telemedicine in the state of Georgia or Nebraska or California or Alaska, all of which are places that we've had patients from all of the states except for one in the US. And so we see patients from quite a distance. If I do that, I get indicted for practicing medicine over state lines. So we have been working with people. So Senator Udall was one, and his father, Morris Udall, as the Udall Parkinson Act. We've been working hard to get that change, to define the telemedicine encounter as to where the doctor is and not where the patient is, and to get progressive. So Canada is actually the largest user of telehealth in the world. They've been the leader, and they've had people in different provinces, and they save $35 to $40 billion a year. Right. And so this crisis, we're actually seeing the legislation change in real time. Right. We're seeing the Medicare legislation change in real time. And I have to say, there are not always a lot of silver linings about crises, but I think that telemedicine is going to be a silver lining for this. And what I would say to people is, Dr. Southwick is absolutely correct. So if you're a Parkinson patient, let's first talk about the scenario where you're going in for your Parkinson care. A lot of times it's a regular checkup, A lot of times the changes aren't things physically in you, but they're changes in the way that you're seeing your symptoms, and you can describe those over the phone or in a telemedicine visit, and we can do your medication refill. So if we can accomplish those things without having you come in and putting you at risk, we should do that, For your other doctor's appointments, same rules, However, if you are having a severe problem where you are not sure, phone your doctor's office, tell them, I am coming in, I'm coming in at this time, so they can be sure to have things set up. So in our institute, for example, at Fixel, we have a large waiting area. We have two different waiting areas, and we have an outside waiting area, and we're pushing people apart. So we're keeping people apart and socially distancing them, and we're trying to get them right back so people aren't sitting in the waiting room next to each other. So there is a way to stay out of the crowds and stay out of the crowded waiting rooms and get the care if you need it. So if you have a stroke, or if you have a heart palpitation, you have a thing, you still need to go in and be seen. Always good if you can call ahead so they can make preparations. And the CDC recommends, if you have a cough, fever, or symptoms of what seems like an upper respiratory infection, like a cold with cough and fever in particular, that you call ahead to the emergency room or your doctor's office so they can be prepared to isolate you when you come in, and tell the people when you check in, you can be isolated and you'll be taken care of right away, which is nice too. So remember, you want to protect other people. We want to take care of things right away and keep people at safe distances. And so it's super important to remember this, and we should take advantage of the technologies.
Right.
Now, one of the questions that just came, and welcome to Massachusetts, just joined along to us. One of the questions that just came in is there's a huge scare about ibuprofen use. And here's how it unfolded. So you're seeing a very high mortality rate with this virus, higher than with flu.
Right.
Okay, so we said that earlier in the Facebook Live. We should be concerned because the mortality here is higher than flu. Okay, and when you see a high mortality, what happens is people start to say, well, what did those people do when they died? And a lot of the people that are on this or have this COVID-19 are having fevers. What do you take when you have a fever? You take ibuprofen, you take Tylenol, you take all these drugs. And so, of course, when somebody dies, particularly somebody younger, and the only thing they're on is ibuprofen, there's an assumption made, oh, well, it must have been the ibuprofen that caused the mortality or the morbidity in this particular patient. So I'd like to ask Dr. Southwick, he's an internist, an infectious disease expert.
Right.
This idea that ibuprofen is causing death in COVID. There was a story this morning on the BBC about it being a myth. Do you believe it's myth, fact, or fiction?
I don't think we can know at this point, unfortunately. But and I checked yesterday, the WHO is actually recommending against using ibuprofen, not because there's any clear evidence, but there is enough anecdotal evidence that they're concerned. And acetaminophen or Tylenol actually probably works reasonably well. Another thing that we just done in pediatrics is alternating an aspirin-like agent and Tylenol, and I think that is possible too. Naturally, everybody is terribly frightened, and when a patient goes downhill so quickly, we're grasping at straws. But remember, association does not mean cause and effect, and that's the key. And when we get these associations, and they're and reading the little material there is on it, it is anecdotal. I saw 2 cases, a series of 2, a series of 3 from one individual, and they're scared. It's coming mainly emanating from France. They seem to be particularly concerned about the ibuprofen. One of the things I for reasons that aren't totally clear, paracetamol, which is their Tylenol, a lot of people overdose on that in Europe. And so I think the physicians have discouraged the use of Tylenol because of that problem. So I think they may be using more ibuprofen. Therefore, they're going to see more cases with COVID-19 who get sick who are on ibuprofen. So I think it's up in the air. If you're, and I can't say yes or no, but I doubt it.
Okay.
I doubt it.
And last question here, and then I'll summarize all of our points. People are concerned because they are going out, and we're receiving questions here from all over the U.S. And one of the common questions, and we have a perfect opportunity to ask an infectious disease expert for Parkinson patients. They're saying, I can't find masks. I want to buy up all the masks. I even got a text from somebody yesterday. Can you go to the hospital and steal a box of masks and ship it to me, so I can put it on people coming in to the room? Can you address the mask issue, because it's been widely reported that a mask is not useful in this
exactly.
pandemic.
The CDC does not recommend it, and when you think about it, a mask mostly protects you from spreading something to somebody else. But if you aren't infected, what happens is a lot of times you adjust the mask and you touch your face, so you may actually have a higher likelihood of infection if you wear a mask, because you're messing around with your face all the time. So there's absolutely no evidence that you wearing a mask will protect you. So we in healthcare, where we're high likelihood of coming in contact, yes, we need the mask. And one of the problems is if the lay public takes all the masks and hoards the masks, then the healthcare providers cannot get them. And I just heard on the radio, they're seeing in Italy, there's something like 1,800 healthcare providers have gotten the virus. And it's because there's insufficient numbers of protective masks. And so by doing that, you're actually taking away from the healthcare providers and increasing their risk of actually dying and not being able to help with care. So and when you get exposed, you have to come out of the system. So you're seeing a drop in the number of providers at the very time where the number of cases is going up. So I think it is, if we think about our whole community and what's best for us all, it's best for you not to wear a mask and to make sure those masks stay in the hospital and not buy them up so that the hospitals can't have them.
Fantastic. So I'm going to summarize here as we're come to the end of our hour. We've had a great discussion about coronavirus and Parkinson, and we've tried to focus it for learning about the virus and also about what we can do as a Parkinson disease community. Our guest here is Dr. Fred Southwick. He is the distinguished professor here at the University of Florida, also the former chief of infectious diseases, and he has a very nice video that he's made available to us at parkinson.org/corona. And then he's going to put a series of 4 presentations up, slide presentations, for those of you that want to be at the top of your class and really learn everything there is about this. A couple of points that I want to make: wash your hands 20 seconds, happy birthday twice, try to stay inside, prevent cabin fever, do the things we talked about, reach out on the phones, help people psychologically, use telemedicine, both into the homes and into the nursing homes for people who can't come out. If you want to bring somebody out of a nursing home or rehab facility, talk to the team and make sure we understand the risks and benefits. It could be a greater risk to take them out, or maybe not. You've got to make that choice. And we need to make sure that regular appointments are delayed. We do our refills by calling up the physician's office. Try to get 3 months of your medications. I think that's a really important tip. And when you're driving through the pharmacy, if you need to pick up something else, ask the pharmacy tech to grab it off the shelf, so maybe you don't have to come in. Younger and older Parkinson patients are at high risk for this virus. Do not fly, do not travel. It's okay to take walks, okay? And but stay by yourself and just to the people that are in your home with you. And don't interact with other people. All these pictures of people on the beach, bad. Don't do what Dr. Southwick and I are doing. Stay about 3 times the distance that we are now doing this educational series. So socially distance, get your Pneumovax, get your flu shot. One is for bacteria, one is for virus. You need both. Defer dental work and defer all non-urgent appointments the best that you can. And ibuprofen is probably okay, but if you're worried about it, you can take Tylenol or something else, but it's probably a myth, and we're probably misattributing the deaths to ibuprofen in those cases, but it's too early to tell. So thank you again. We're seeing questions from all over the world, and we are going to put this up after we end this live Facebook stream. If you like this, say thank you to the Parkinson organization. John Lair, who's the CEO, has done a wonderful job. Fred Southwick, thank you for being our guest. He's a great author. You should look up his books. He's written many books on keeping the healthcare system safe. And you also have a Twitter handle too.
Yeah, at FS Southwick. And I actually have an infectious disease book. It's a 450 pages, which is a short book, Lang series, coming out April 15th.
All right.
And the reason that I'm doing these videos is I could not get COVID-19 into the book because it was at the printer when this epidemic hit. And so I'm actually creating the videos for McGraw-Hill, but I'm just giving them out everywhere.
That's fantastic.
Because I think that'll be very, very helpful. And it's incredibly challenging time for us all.
Fantastic.
And I think the other lesson is think of everyone, not just of yourself. We truly need to become a community where we're looking out for each other. If we do that, I think we will behave in the right way.
That's fantastic. And I'll just mention as well, Ray Dorsey, Boston Bloom, Todd Scherer, and myself, yesterday we had a book released by Hachette Publishing called Ending Parkinson Disease that's out as well. So if you're caught with cabin fever, I know Ray would love for you to pick up a copy of Ending Parkinson Disease and read that, and also just the numbers of Parkinson disease and what we're going to be doing. So thank you again, and we will make this available to you. If you like it, we'll do more. and stay safe. So thank you from the Fixel Studios and from the Parkinson's Foundation. Thank you very much.
Mhm.